So
you never really know. There's a lot of possibilities. You never really know until you know.
yeah,
So,
right.
like, there could be some really nice sized ones right out in the middle.
Yeah,
You know?
I hear you.
So first, the reason I'm doing this right here is this part of the fish is a thin section of the body wall.
Okay.
So if you were to go like make the incision here, it would still work, but you'd have to go through a lot thicker muscle to get to the peritoneal cavity there. So you take these scales off because they're hard to cut through, making a small section there, and then don't worry about it. Don't worry about it. Then go in here, and I'm going to go ahead and make an incision.
Straight down. Okay.
Straight down, and I'm going to go small cuts, and I'm going to basically, partially by feel, partially by sight, I'm going to keep cutting down until I go through the body wall. And you see that hole there?
Yep.
So now, in this case, there's no blood. It's not. There's a little bleeding there, but you can see in there. And so I'm going to take this guide. So I haven't. What I've done now is just gone in, and we're trying to make sure that I don't puncture the gonads.
Okay.
Because that causes more stress. So I'm going to go in with this blunt thing that can't cut anything. And that allows me to guide the blade. So I can cut without worrying about hitting those gonads.
I see.
And then I'm making the incision just wide enough so that I can come back with the tag and fit it in there. So I'm just going to open it like that.
Cool.
And then next step is to put the guide in, and this will be how the antenna will stick out the side of the fish. So this is just a heavy gauge hypodermic.
Okay.
Go under a scale, and then that's going through the body wall, and the guide is preventing me again from puncturing into the fish. And then we kind of set it like that. And then I'm going to triple check that I have the tag number correct. This tag is sterile. It's in sterile gauze. It's been sterilized in isopropyl 48151. We've got it. So now this is going to be threaded through the hypodermic needle. Pull this out the back. Pull this out. Now I'm going to insert the tag. So I'm going to use this to kind of open up the cavity here. Oh.
I left my lunch in the fridge. What?
There we go. So get that in there. Now we're going to use this to aim it forward, and the tissue in there, there's connective tissue, but you just slowly push it in and then forward up above. So you want it to sit ahead of the incision. So then I've got that placed in there. Now I'm going to untwist this, pull that clean.
And then it's time for sutures?
Yep, now it's just the same. So what you saw before, just going to go shallow as possible under the skin, not through the muscle wall. And these are dissolvable stitches, so they'll hold that thing shut for a few days.
Just a half hitch on the...
Yep, so we do one good old surgeon knot, 2, 3 to lock it.
Okay.
And then trim, and...
Sorry.
No, that's fine. You're fine. So she's already starting to come back, just on schedule. And that blood is actually good. It helps heal the wound.
Right.
clots up, and once in a while you'll never hit a blood vessel in the cut, and then that actually isn't good. Blood kind of forms a barrier, keeps water from entering into their inner cavity there, which is not good. One more, will be good.
Where do you guys get the material from?
For the
Like the stitches and the
veterinary supply.
Okay.
Yep. Stitches are probably the most expensive piece.
Really?
Yeah, they're about $20 a piece. But
For how what's
It's
the
like,
length you get on that?
27 inches.
Okay.
So that'll do a couple fish. It's not a problem.
But you
It's
have to learn how to be efficient
yeah,
with it.
yeah, yep. So there's that.
She's ready to go.